Hello and very good morning. So first of all, big thank you for yesterday's response. It was so good. And that's why, say, today you'll be watching something which is directly what is seen under the microscope. Right, as promised, we'll be discussing the tissues, but following all the principles whatsoever we have learnt till date. Right. It was a small request which was made that please give first 5 7 minutes so that people can say come. Well, I would always say that we'll always be starting sharp at the given time. Right? Anyway, no worries. So let's see what we'll be discussing today. Right? We'll take the first 5 7 minutes bit slow and then we'll really pick up the pace because there is lots of ground to be covered today. So many things. And in fact, there are so many different type of tissues and I would like to show you almost all of them, not only just one single image. We'll be watching it under low resolution, then we'll zoom it, right? That is at say 10x, 40x, even 100x. And in every image we'll be able to understand the concept that why the tissue, if the tissue is like this flat and there is the nucleus over here, so then why is it so, right? So by the end, trust me, by the end of that particular section you'll be able to diagnose crisp clear that this particular image, this particular slide is of this tissue only, right? Beyond doubt, we'll try to settle each and every case in this way. All right. So let's start with our today's topic. Yeah, and uh, I'm sorry. Can these comments be stopped? It's like say if anyone is taking admission to this club or that club, please don't do that. I'm telling this thing in benefit of all the students because if one such comment, immediately others would be distracted. So it is a humble request to those who are attending not to do that. Because what really happens is not only it is the distraction for you guys, it is distraction for me also. So please don't do that. Right? A very good morning to everyone. And it's like we'll follow a very strict discipline. Very, very strict discipline. Please type only when it is asked. Right? I don't mind keeping the chat on. Right? Yes. Good morning. Yeah, good morning. Right? That's all very nice. So nice of you. But the thing is, please don't type anything else. Yes, I'll be asking you very specific questions that what do you think? What type of tissue it is? At that time, bindas, right? You full-fledged go ahead with your answers because that's what interaction is needed. In case yesterday when we were discussing about medial and lateral, yeah, it was fine. You answered it, right? It's fine if it was incorrect, but you attempted it. Uh, what you suggest for abroad? See, uh, if we'll keep on discussing about those points, we'll miss this topic, right? Don't worry. Do one thing. Whenever you have got any of the doubt, please you are free to write in comment section, right? We'll definitely take that, and I'll answer it over there also, so that it is very easy for everyone even to read it, right? So no worries. But let's start with our today's topic. See, my intention is, as said, that in the span of 4 days, we prepare the complete groundwork. Day 1, day 2, day 3, and day 4. Day 1 was like that what exactly would be our method and how shall we proceed. Now, today you will see that difference. You will see that whatever we were, say, learning in the initial sections, that's what we shall be implementing today. Right? At no point of time I'll straight away out of thin air would say, okay, this is a cuboidal epithelium. No, I'll never do that. Unless and until I have explained you that how it is really working on. Right? So that's the reason I always say that please pay full focus, complete attention, right? So, yes, good morning, and let's start with our subject. Okay, as we said, brain mapping. See the first thing, that's brain mapping. Human body, yes, we, ourselves. So, our topic is to learn about the various tissues. Sure. So, we start with that there are four types of tissues. One is the epithelial tissue or the epithelium, connective tissue, neuronal tissue, and the muscles. Right? So, these are the four. So, epithelium, connective, neuronal, and the muscles. Now, these are four giant topics, huge, big topics. When we talk about epithelium, yes, you'll see that today we'll be covering the epithelium part only. There is so much to it. Tomorrow we'll be taking connective tissue, muscles, and neuronal. Because once your concept is clean, you yourself would be surprised that at what pace you can really learn. Yes, and as you will increase the pace, I'll also increase my pace. Right? So first, because it is the beginning, we'll take it step by step. So here it is, what we were discussing, the super reading in that, the brain mapping. We could have written it like 1, 2, 3, 4. No, we'll never do that. Only in certain cases, we'll just put it 1, 2, 3, 4, 5. Otherwise, it will be like a brain mapping. And time to time, I'll keep on drawing it. Right? Now see, out of this entire thing, epithelium, connective, neuronal, and muscles. If I'm told that you pick up one word which is very easy, I would pick up the word muscle. Right? I'll pick up the word muscle, easy to understand. Right? When we say always make this habit, always start with the easiest word which clicks your mind. So we say that yes, muscle is easy, right? And then this muscle can work only if there is a nerve associated it, because someone has to say give power to that, right? So that is the nerve, which is like our electrical system. Yesterday only we talked about it, electrical system. Now muscle alone, right, it is lying on the table, he can't do anything. Muscle has to be connected with something, right? So if it is connected with one specific structure, right, so then when it contracts, so that means that distal end would move, right? That's the function of muscle. So when you take dumbbell and then when you move, so you know that yes, biceps, right? The moment muscles come, immediately we say biceps. Right? So that means that's how the movement is. But then there are few connective tissues. It is not so that entire body there is only muscles. Even there are tissues. There are say connective tissues. Those who have got several functions. So yes, this is also a very big topic, and that would be the topic for tomorrow. Today we are talking about epithelium, that fine covering, a very mysterious topic, right? And once we have learned this mysterious topic, rest of the topics they become so easy because they are based on something which we'll be learning today. So yeah, in muscles there are striated, smooth, and cardiac, but don't worry, we'll talk about it tomorrow. Just a brief. Striated means they are under your control, right? They are under your control. So when you want to give smile, right, those muscles, they are under your control. Smooth muscles, as we said, right, that is heart, right? Actually, the heart doesn't look like this, right? This is when you really see the heart, you feel, "Acha, this is what I give to someone," right? But that's okay. And say these are the smooth muscles which are into digestive system, etc. But we said we drew the heart over here. Then what about cardiac? Well, actually, heart is not also not under our control, right? In every way, but this is a very special function. What special function, right? This special function, it has nothing to do with Valentine's Day, but this function is that it is an automated system. Every muscle, say stomach won't start digesting by itself, right? The message would come from the head, from the brain, right? Pancreas, so a message would come, yes, okay, start secreting the insulin. So there are hormonal systems, there are neuronal systems, and then they will keep on firing and they will keep on working. It is the heart is something which is not requiring anyone's interference. Heart would say, leave the entire thing to me and I'll keep on pumping constantly without any motivation. Right? So heart is someone who beats without any motivation. It is self-motivated. And then we gave the name SA node. Right? So we'll talk about all this, but in brief, something under your control, something under not your control, and something who is controlling himself. So these are the types of muscles. But actually, when you see these muscles under the microscope, you will find that they are beautifully differentiated. Just by looks at it, you will be able to tell. But today's focus, that is epithelium. We drill down this to our complete basic. Epithelium is nothing but all cells, simplest of the cell. Simple cells, they are tightly opposed to each other. One after the another, they are arranged, right? One after the another in one sequence. And they are all sitting on basement membrane. So you can say that basement membrane is that membrane which is providing base to all these cells. That's why its name is basement membrane, right? Interestingly, there is no vascular tissue in between. So then how do these cells live, right? There is no vascular tissue. That's the thing, right? We'll see. So this is a cell, and in between, invariably, you will be able to identify that that is the nucleus. Now, this nucleus is very important for us because this nucleus will be giving us the idea that what type of this particular cell is, right? Okay, so let's see how do we divide this. See, epithelium, it can be divided into two parts, membranous and glandular, right? Membranous and glandular. Glandular is that, see, all the cells, they are pointing towards one lumen, right? One lumen. It means every cell will be secreting into one space. So this is nothing but a gland. Now let's say you have taken the morning breakfast, right? And let's say if there was a very tasty dish, even if you remember that, right? Even if you remember that dish, there would be, your mouth will be watering. So that is nothing but these are the salivary glands, right? These are the salivary glands. They secrete saliva. So all these secretions, there are various types of secretions. But see, these secretions, they are going into one cavity. Into one cavity. So everyone is secreting inside like this, right? So such, they are called as the glandular. However, in this case, this first case, we are starting with this, it is membranous. Sheets of layers, sheets, right? One after the layer, all those cells, they are just lying. Where do we see these membranous? They are present in external surface. So this means it is skin. Yes, it is skin. Skin is the simplest, right? So when we see all these layers, right? All these layers. So even when we do like this, see thousands of cells, they are lying over there, right? When you scrub your hand, when you wash your hand, and that's how all those cells, they are the membranous cells which are lying over there. In body cavities, when we say body cavities, this tells us few more instructions to learn. See, in medical, you will come across this peri word, pericardial. That means surrounding the heart, right? Then this is peritoneal. This is in abdomen, peritoneal cavity. That is into the abdominal cavity. Then pleura. That means we are talking about those lungs, right? Those lungs, they are also packed. They are packed, right? There is a layer surrounding it. CVS, cardiovascular system, right? Over there, the heart, other arteries, veins, etc. You will find that these are all surrounded by specific layers. Now these layers, they are also having epithelial tissue, right? We'll see all these things whatsoever we are talking about right now. It is like theory, but we'll see all the images so that nothing is left by chance. Then see, there are few body tubes like respiratory. It means when we breathe, right? So then as it goes inside, so there is trachea, right? That trachea. So when someone is strangulated, right, gala dabate hain, so actually it is this part. So over here, if you really want to feel the trachea, all you need to do is just take a finger and just put it over here and try to speak, right? You will feel that. The moment you feel that trachea, you will feel that there is something like this, right? There are some ridges. There is something which is hard, right? You try to move it over here on your hand, you'll find that that is so smooth, right? But you try to move it over here, you'll feel that something is coming in between. Friends, that is nothing but it is a cartilage. It is cartilage. This entire trachea is designed in such a way that it cannot collapse by itself, right? There is cartilage, so that cartilage is keeping it on, keeping it in full, so that there is no trouble in breathing. As you go down, you must be knowing that it divides, and then on both the sides the lungs are associated. So that is, these are the body tubes, respiratory system. Similarly, the GI system, it's not so that 24 hours we have to eat. Yeah, 24 hours we have to breathe. So in GI system, there is no point in keeping those tracks open all the time. So that's why when you see the cut section, you'll find that this esophagus, right? Esophagus is collapsible. It is a tube which can easily be collapsed, not the trachea, right? So the mechanisms, they are so beautiful that they have got a specific function to follow. Similarly, the urogenital system, urinary and genital system, right? All those, they are called as the body tubes. So this includes ureter, right? So then the bladder. So kidneys, they keep on making the urine, and the bladder is constantly connecting. So bladder is getting full. But it's not like that the moment 10 ml of fluid is collected and immediately one has to rush to washroom. No, it never happens, because there are sphincters, right? Sphincter means something which is closing that system. So there is a voluntary system. Unless and until you allow, that urine won't be passing further. So that is what is called as the voluntary system, right? And we'll learn about it when we'll be discussing anatomy, etc. So function of this epithelium. Right now we are focusing on function of epithelium. So that those simple layers, right, what function can they do? One is the protection, right? Second is secretion, as we discussed. Third is absorption, because see what happens in digestive system, right? In digestive system, whatever we eat, right, in stomach, those epithelial layers, they are sitting and they are telling you, okay, whatever you have eaten, let's digest it and take the nutrients out of it. Nutrients or waste, whatever, right? If someone has taken alcohol, digestive system would say, okay, fine, I'll take the alcohol also. I'll throw it to liver and I'll tell the liver, now you handle it. If the nutrients are there, that also will be presented to liver, and liver will say, yes, I'll work on it. And then what I'll do, I'll make those currencies which can be utilized by body, right? And that currency of the body, that is the energy currency of the body, is, now you can type, energy currency of the body is, and don't type short, right? Try to type full. What was that? The currency of the body, energy currency of the body. Body understands only this. So currency of the body, the energy, yeah, but that's what I said. Don't type that acronym. Write full. ATP is correct. Yeah, that's fine. ATP is correct. But ATP is, what is the full form of ATP? Adenosine triphosphate. Very right. And then there was ADP, AMP, right? They are also there. But utilized, so it is only adenosine triphosphate, right? It is not TRY, it has to be TRI, right? No problem. TRI means 3. Okay. All right. Good, 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 good. So next, so that's what is called as the absorption. Next is sensory. Oh yes, there is sensory system, right? And then there are active transport. What are these things? Say sensory to you understand, right? It means that if when there is pain, we if there is some heated thing touching over on the surface, we feel this heat. We feel heat, we feel cold, we feel touch, right? Yeah, we feel every sensation. So they are all sensory systems. There is something what is called as active transport, right? So it means when we say transport, right? What is transport? Transport is simply moving from one point to another point, from point A to point B. That is called as transport. Are we using any energy in this? Well, if there is slope and we just put a ball, to that ball will keep on rolling down, right? No energy is used, right? And if we have to go uphill, so then energy is utilized. See, almost in every field, we have got this concept. Are you using energy or you are not using energy? If you are not using energy, this is called as the passive transport. Passive transport. It is occurring by itself, right? Nothing is needed. And when you are requiring some energy, it is called as active transport, right? So this is the difference, active transport and the passive transport. Now you'll be interested in one very fine thing. You know, in space, there is so much of fight, right? There is fight. The way in our buildings, there is usually a fight of that who will park their car, right? Because cars are more and the space is less. That's the problem almost everywhere. But that problem is in space also. Everyone is fighting for one specific orbit. One specific orbit. And that specific orbit is what is called as the geostationary orbit. Geostationary orbit. Everyone is fighting for it. Now in space also there is a distance, there has to be a distance of 110 kilometer, which is what is called as the parking distance, right? Safe parking. Now in this orbit, even if you put a stone, right? That stone will keep on revolving around the earth without any effort. How nice. But if you try to put anything into the lower orbit, slowly and gradually earth would start pulling, and boom, one day it will crash on the earth. What if we put it outside? Slowly and gradually it will go out, and it will be lost into the space. So it means this is geostationary orbit is the best orbit. You don't have to do anything and it occurs by itself. That's what is called as the passive process. In our body also, there are few passive transfers, right? Yeah, energy is used for active transport, true. So over here, even in our body, there are few passive transport, but here we are focusing on active transport. And in that case, this epithelium would be playing a role, right? So now you will not forget that here energy is utilized. Okay. Let's see how do we divide this. First thing first, every terminology in medical science, right, they are inspired by some Greek or Latin words, right? So parallelly, when we say gastroenterology or gastritis, so this means it is related to stomach. Stomach means it is like a leather bag, right? So initially the names were given in such a way because they were working way back than other say communities of the world. So obviously when we say that how the words develop, it is like when we say cat, cat. So in that case, that image starts appearing, that this is how a cat looks like. So our brain will synchronize it. What they did, they said that how can you explain that this is stomach? They said this is looking like a leather bag, right? This is looking like a leather bag, and that's what they said, that this is looking like gastros, because in Latin, in Greek, it is that leather bag. So everywhere they will be giving some comparison from their looks, right? So similarly, squamous, this is the first word which is coming up, squamous. We are talking about epithelium, right? So the first word which is coming up, epithelial tissue, it is squamous. Squama means flat. This means it is flat. Yes, so this would be the shape. It means these muscles, these not muscles, these cells, they will be arranged like this, right? One after the another. And how do we really identify that? Right? Can we identify every individual cell? Well, it is not easy. If you just open the abdomen, you open that tissue, and with a very fine magnifying glass, right, like a detective, you just start watching it and zoom. Yes, you might be able to see those cells, but well, it's not easy. How the cells are seen? These are the tissues which are with a microtome, a very fine slice is taken, then they are stained, and then they are seen under the microscope. Now there is one structure which will be best stained, and that structure is called as the nucleus. Nucleus is seen best, right? Because it has got specific affinity. Affinity means attraction. It has got specific attraction towards these dyes. So this nucleus will always say, okay, dye, come, right, come. And they will be all stained. So under microscope, we'll be able to see these nucleus very well. Very finely we'll be able to see. So let's take advantage of it. So in case of squamous, they are flat. So obviously their height would be less than their width. So that's how it looks like, right? The height is less than the width. Width is more, height is less. And the nucleus is flat. So this is what is called as the flat nucleus. Nucleus is also flat. The cell is also flat. And we say that their main purpose would be active transport. Where can we expect this active transport? Let's say wherever there has to be passage of one substance from one cavity to another cavity, right? Just remember that. We, as promised, you don't have to cram, you have to just understand. Okay, so at least this part is completely clear, right, that it is a squamous thing. Okay, what other? See, all permutation combination, whatever comes in your mind, you just put that and you'll find that yes, there is a such type of cell. One, we said that here height is less, right? So my next combination would come when height is equal. Height is equal to the width. So that is what is called as the cuboidal, right? That is called as the cuboidal. That's right. That's right. Walls of blood vessel. So that is what is called as the cuboidal. Cuboidal is height and width same. So here there is more space, right? Previously, so there was no space for the nucleus. So bichara nucleus was also flat. But now we have given the space. So nucleus will also say, yes, I'll also occupy more space, and it will become big round nucleus. Mark this point, right? Keep this thing in your mind, because when you will see this nucleus, you'll be so happy, right? You'll be so happy to see that nucleus, because that nucleus would jump and say, come on, I am this tissue, right? That's how it will look like. So secretion and absorption. Obviously, this mota taja nucleus, right? He will be doing this function, secretion and absorption, right? He will absorb and he will secrete. Okay. Now let's go for the third combination. Previously the height was less. Now the height is same. So now we increase the height. So over here, that's our keyword, right? We increase the height. When we increase the height, so it is like a big column, right? Height is more. So we call this thing columnar. This was like a cube. This is like a column, right? So easy. So again, you are giving more space to nucleus. So nucleus will also change its dimension, right? I'll also be elongated, right? So yes, this is elongated nucleus. Obviously, they are so big, so they'll say, okay, we also do the function of absorption and secretion, active phase, right? Actively, they'll be working. Okay. Now, so we understood one concept, but story doesn't end over here. There are some tissues which are very satisfied tissues. They'll say, okay, just give us one layer and we are happy. So they are like called as simple squamous, right? They are bichara very simple. Simple means just one layer. So whether that one layer is the most simplest, right? Squamous. So we call that thing as simple squamous epithelium. Now instead of this, if they are like this, right? So we say that this is simple cuboidal. And yes, don't forget to make big nucleus in that. And when they are columnar, right, again, like those soldiers, they all are standing one after the another, but nucleus are elongated. So again, there is only one layer, so it means they are simple, they are satisfied. So they'll say, we'll give them the name simple columnar epithelium. And just a small reminder that all of them, they are resting on the base because they all are soldiers. So that is our base, basement membrane, right? Don't forget the basement membrane. They are not hanging in air, they are basement membrane. One layer, so we call that simple. Now when there are more layers, right, these are the multiple layers. So multiple layers means we give them a new name. So this name, remember, so that's why I'm marking it specifically. This name is stratified. If you speak also stratified means thrown into layers, right? So name is given as per the shape of top layer of cells. What is this? Why I have written this thing in red? It is written in red because in body there is nothing like that everything goes by the rules of geometry. Everything goes by the rules of physics. Everything goes by the rules of, because it is the dynamism, because everything is constantly changing. So it means when such big cells, right, they are lying on top of each other, what would happen to which are those last cells, right? They'll be pressed down. Obviously they won't be of the same size as that of top layer. So then how do we give the name? So no problem for these flat layers, right? These small squamous epithelium, because they are thin. So 1 layer, 2 layer, 3 layer, 4 layer, no problems. Even cuboidal is okay, but in cases of columnar, these large cells, when they stake themselves one over each other, those bottom cells, they start going down because of the pressure. So that's why we made one rule, that what name would give? You'll give the name as per the shape of top layer. Over here, the topmost layer is what? Topmost layer is columnar. So we'll call it stratified columnar. Is that clear? Right? Stratified columnar. So even if there are 10 layers, but we'll just see the top layer. Top layer is what? And we'll give the name accordingly. So that was the point to understand in this case, right? Otherwise, rest is very easy. Simple squamous, simple cuboidal, simple columnar, stratified squamous, stratified cuboidal, and stratified columnar. This was just a small portion of theory. Now there are some other variations also, right? There are some other variations. Let's not worry about it. We'll come back to it. But first, see the images, right? So that's what. See, the variations are like when the nuclei, and again I said, think of all the possibilities. You think it like, can the nuclei be some at up level, some at below, right? Why all of them should be arranged in one line? Yeah, possible. So then we'll give it some different name. What if one cell is bigger, one is smaller? So again, we'll give it some name. What if these cells, they change with their function? Yes, we'll give some name to that. But that is after learning the normal part, right? So these are all variations. We'll come back definitely to these variations. So first, let's see them. Now, tons of material would be written on that. The moment you see simple squamous epithelium, and paragraphs will come up. Do you really need to remember that much? Well, they are useful, but first, to begin with, only the keywords. Identification points, say you will be considered as master if the slide is given to you and just by watching you just say that this is a simple squamous epithelium and this is a part of the lymphatics. Instantly if you answer, then they say that yes, your precision is impeccable. That's what I want. Will identify with, let's see, now I have to speak this thing in low volume because I am teaching you a very stylish cheating. Yeah, very stylish cheating. See, at times it happens that if you are confident that this is the slide of, say, kidney, right? The section has been taken and it is displaying, say, cortex. And just giving you one example. But when you know that this is that slide, your confidence would be so high and you will be able to say, okay, I can see those collecting tubules and see in fact there are those afferent and efferent vessels, they are also seen. Someone would wonder that how can he see such small structures? You will say, yeah, it is so easy. Yeah, you will say it is so easy because you know that it is that structure. You have identified it. This is what I normally see, especially, again, right? If anyone is into that Jyotish Shastra, right, please don't scold me. But at times they say कि अच्छा आपका अच्छा होगा, आपका हाथ देख के मैं ये देख सकता हूँ, वो देख सकता हूँ. And if it actually happens, right, how confident that person would say, yes, because it was because of this ग्रह and that ग्रह and मैंने तो पहले ही बता दिया था आपको कि ऐसा होगा वैसा होगा. I liked one very fine trick. There was a movie of I think Abhishek Bachchan. Right? The name of the movie was Bluff Master. In that 2 minutes dialogue, what he said is that, see, it is so easy to do the business. Right? Open one share market company. Right? Send a message to 100 customers that share of say out of these 100, send the message to 50 that price of this particular XYZ share will go up and price of this will go down. Now if it actually goes up, so in that case forget about these, divide this into two parts, 25 each, give them another share ABC and tell half of them ABC. For some reason share goes down, no problem, forget about them. Divide these into two, right? Like say roughly 12, right? Say PQR, another third share, say it will increase, it will decrease, right? PQR. And in case if it goes up, forget about this. These are your permanent clients. Then you can say, see boss, we said 3 times and all the 3 times we were correct. Do the business. They will be putting their faith into you 100%. Now this is so true. This is so true. But this gave me the idea that if we can really, in medical science, if we can figure out such things that which are sure shot, something which cannot be missed, so then it becomes exceedingly easy and then you can give all the descriptions in the world. This is what we are about to learn. And as we said that we'll just see that central nuclei. Because central nuclei is very easy to see. Why? Because it is dark stained. Dark stained central nuclei. Right? Let's see that. And where are they present? In all these structures. Now in books, in all those atlas, it becomes like when they discuss squamous epithelium, right? There will be lengthy descriptions of the entire page and then there will be 1 or 2 images. These 1 or 2 images will be taken from any of these structures and it is said you just see those images and that's it. No, Will not do that. These simple squamous epithelium is present in arteries, arterioles, they are present in heart, they are present in kidney, they are present in lymphatics, and they are present in lungs. Let's see in all of them, and let's see all of them under different resolution. So when you see it under different resolution, right, initially you see it at a low resolution, so it will give you a wider picture. Then you go into the depth, same tissue, right, same tissue will keep on going deeper, 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 and then we come up with that how beautiful the entire world is. So let's start. The first thing, this is arteriole, right, arteriole. We say that anything which goes from the heart, right, it is artery. Anything, the blood which is coming back, it is called as the veins. So organs are over here. But over here, these artery and veins, right, they divide, these arteries, they divide. So they become very thin. Finally, they are like capillaries, and then they are supplying. So they are like arterioles, right? Much smaller version of artery. So over here, we have taken a cross section. When we take a cross section, right, so this is not artery, this is the entire tissue. There are so many things. But see, there are all small blood vessels, right? All these small blood vessels. See, so many blood vessels, right? All small blood vessels. So let's zoom it, right? This is a same thing, right? Say over here, right? We are picking up, say, this part, right? So now we are zooming it and we watch that is it fulfilling our, see how difficult it is to figure out where the cells are, right? But one thing is very clear, that can you look at the shape of these nuclei? They are dark stained and they are flat, right? Flat, right? I'm drawing it, right? Then I'll erase it. So, but just to see, right? They are flat, right? They are flat, correct? Now I'll erase all of them. See, you should be able to see it in normal way. So these are the flat nucleus. Just by this principle that there is only one layer. So one layer of flat nuclei. Bas khatam. We now know this thing that we are dealing with simple squamous. Right? We are dealing with simple squamous. Okay. So then you can boast on that, see the walls of the cells, they are opposed to each other. Obviously they will be opposed, right? Opposed means they are all standing next to each other. And we can see that these cells are on basement layer. Where is basement layer? Can you really see? It requires higher resolution. No, but because I have got the eagle's eye, right? I can see, a microscope has been gifted to me right from the birth, and that's how you start describing, and people will be wondering that how accurate he is. But you have just picked up one simple thing. Let's see more, right? It's a great fun. See, no doubt about it. The nuclei flat. You can't miss it. And don't worry, I'll be showing you all the nuclei, right? Those big round nuclei. All you need to understand is whether it is flat, whether it is round, or it is elongated. Bas, that's it, right? Histology, actually, it is a great fun. Then as we'll proceed, I'll show you how to differentiate between the slides. And one of the trick is, right, as no teacher is present over here, I can disclose that in exam, when it is shown, asked to you that which slide it is, if someone is not watching, take the slide out and watch it in light and then put it back. So many slides, they are like, they give the clue just by watching the shape of that organ, right? I'll teach you that also. And it is not cheating, because nowhere in the exam it is written like that you are not supposed to touch the slide. No. So you are not breaking any rule. Okay? Say yes. Now this is like a masterpiece, right? This is 100x oil immersion, and there we see our fantastic nucleus. And now you can see that this is the whole cell. This is the whole cell, and see how beautiful that cell is. That cell with the flat nucleus, right? And we can even write on it that this is a flat nucleus. Right, so nicely it is seen. Say here is another cell, right? Here is another cell which can be seen. Here is one more cell, right, which can be seen. See over here, they are the cells. Here it is one more cell, right? Why don't we see a cell over here also? Yeah, it is there. It is there. But when the section is taken, that if that nuclei, sometimes that nuclei is not stained, sometimes that nuclei is spilled off, sometimes that nuclei remains above or below, anything can happen because there is nothing like a laser cut. So it is taken with a microtome in which you will be able to see so many structures. So that's the difference between the images which are normally very ideal image which is shown and the real images. You'll find that there is some discrepancy. You have to make a judgment that that's how the cells look like. But one thing is very clear, you can say that these nuclei, they are into one layer, right? Now that was arteriole. Now see, this is artery. Look at the musculature of that artery. The looks itself is like it is so powerful, right? And as we go deep, right, see, we are going deeper. So this is one complete section. The complete artery has been cut. So it has got all the layers, right? All the layers. Do remember this when we'll be discussing systematically the artery itself. Right now we are just focusing on simple squamous epithelium. So it has got so many different type of cells. Yes, it has got muscles. Arteries has got muscles. Yes, definitely it has got muscles. Now why so? Say when there is, say you sweat, or simply you hold your hand like with pressure and you see that your veins, right, they are all enlarged, right, they are engorged, and you take the pulse, you will find that our body has got two systems. It has got vasodilation and vasoconstriction, right? Vaso means vessels. So vessels dilate, vessels constrict. Why do they do so? Because the system is, we learned one word, homeostasis. Homeostasis. Homeostasis means balance, right? Balance. So how body can balance the fluid? So body would say, Achha, you have not consumed water. Now there is no point in dilating those arteries, right? What's the point? Because when the arteries are dilated, that means there would be more volume and less blood, less fluid. This means that this is the container, but the fluid is only this much. So what will you do? You will say that I need to keep the pressure same, so I'll make that container smaller so that container is filled. This is what happens when we are thirsty. We have not consumed water. So all our bichari veins, arteries, they will all be shrunken, right? They will be constricted. Because body said that I need to maintain the pressure. Why the pressure is to be maintained? Because it is with that pressure, actually the blood will be entering into those tissues. Now if the pressure is decreased, have you seen someone who is going into hypotension, right? So they will feel dizziness, giddiness, right? They say, "Arey, nimbu ka sharbat de do, this de do, just add some salt, add some sugar, that electrolyte solution," and suddenly, as if you have given the current and they are well, they are good. Same thing happens. You have given them the volume, you have given them the nutrients, and you have given them the salt. All these three components, they will actively enter into those areas which are requiring them for balancing the homeostasis. So it means these arteries, they are not under our control, but they are under the sympathetic and parasympathetic system. We'll discuss it, right, as the time permits, but this is the point, that arteries, they have got those muscles, right? Arteries have got muscles, big muscles, depending upon how big the artery is. But here we are going into the lumen. This is the lumen, right? This is the space. And as we zoom it, right, we increase our resolution, and still we increase our resolution. Now see what is happening. at the distal, right, over here, can you see all those nuclei, right? They are the nuclei. See the flat nuclei, right? They are all flat nuclei. That's where we'll be able to see that, right? Still zooming it further, now it is becoming crystal clear. So this is one cell, that's another cell, right? Then this is third cell, and this is the fourth cell, that's another cell. See, this is nothing but simple squamous epithelium. Previously we watched arterioles, now we saw arteries. So arteries are also having simple squamous epithelium, right? One more, atrial wall. This takes us to one more level, atria. Where is atria, right? So when we divide the heart, right, that's heart, right? I know it is completely unromantic figure, but scientifically this is right atrium, right ventricle, and left ventricle. We are dealing with this part. So in atria, when the walls are there, if we see that what type of epithelium is over there, and here is our zoom starts. We zoom now. We have already started watching that they are simply simple squamous, right? See, simple squamous. All these are flat nuclei, right? They are flat nuclei. Now see, because there are other structures also, so at times it might be a bit confusing, but focus only on the nuclei. See, it would be still more clear. Lymphatics, which will be carrying our immune system, right? Which will be carrying that lymph which is used for our immunity. See, this is lymphatic channel. Only by this much you can say that it is definitely simple squamous, because see, like those ants, right, single layer is going all the way, and the moment we zoom it, yes, it is so clear, right? It actually looks like, right, all these tick 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 tick, right, all those ants, they are moving, and we still zoom it. No doubt about it, right? No doubt about it that they are all right, simple squamous, right? So nicely arranged in single layer, right? So disciplined. And the best is this, the kidney. Now in kidney, you will see so many types of cells, right? Actually, you will see so many different types of cells. So just to give you a brief, right, there is a component, the unit is nephron, right? It is, the unit is called as the nephron. Nephron is like a brick. The way we have got the entire building, and brick is the smallest component. Similarly, in the entire kidney, nephron is the functional unit. And there are millions of such units which will be incorporated into that much small space. So how compact the whole structure is. Nephron is like this, right? There is a cup. This cup is what's called as the Bowman's capsule. It is called as the Bowman's capsule. And from here, you will find that there will be tubules, right? There will be descending, there will be loop of Henle and ascending. But in simple words, finally, this is the unit of the nephron. And in this case, there would be arteries going inside and there will be arteries going outside. So those who will be going out, those who will be exiting, exit is starting from E, so we'll call it efferent. So there is no confusion. E means exit, means they will be leaving the Bowman's capsule, and those who are coming, right, they are afferent. And these arteries, right, they will be dividing, right? There'll be entire capillary formation. It happens this way, that when these afferent vessels, they are going in, right, and then Simply because of that pressure, the filtration process would start. So what this nephron would do, nephron would say, acha, acha, come, right? And will say, there is so much of water into the blood, right? So much of water, come on, we have to take it out, right? So it will take that water out. In fact, it is, I'm putting in very simple, as such, it will take care of water, it will take care of sodium, potassium, chlorine, right? So many. And at every stage, right, there would be various functions which will be occurring. But the point is that this particular extraction, right, the water which is taken out, it means that this particular area is involved into transport, right? That's what we talked about, transport. When the substance is moving from one point to another point, now substance is moving from blood, it is entering into this nephron system, and then it will be, all the urine would be collected, and such many nephrons would be working, and all of them, they will be collecting, and this is what is called as the collecting system, or the collecting system, or collecting tubule. And then they will be finally, that's the kidney, they will all be finally exiting via ureter, right? And same thing would happen even on the opposite side, and the urinary bladder would say, okay, I am there for the storage, and then there is a sphincter over here, it will say, I'll keep this sphincter off, right? It is constricted so that no urine leaks outside, because this thing is under central controlled, right? The body itself, brain itself is controlling it, and when the situation, permission, everything is fine, so then there are specific nerves which will be firing that, okay, empty the bladder. That's how the whole system occurs. When you understand it like this, it means if there is any problem in this control mechanism, how can it occur? It can occur if someone, during injury, right, during accident, his spine is damaged. If his spine is damaged, obviously now those nerves which are controlling this, they are damaged. It means person won't be able to hold the urine. These things, they have got so much of importance, right? I tell you one very nice importance is something which is usually not discussed, right? Many times it is not discussed. In case of females, right, after post-pregnancy, there are specific muscles which are weakened, right, levator, ani, etc., right? But when we'll be discussing the, say, anatomy of abdomen and the pelvis, we'll be going into more detail. But just to say that when they are damaged, so it means they will find it difficult to hold the urine when there is increased intra-abdominal pressure, right? So what happens that when those elderly female, when they laugh, when they cough, right, there would be dribbling of small amount of urine. It can happen. So that's the reason that when it is said that everyone, right, should understand the entire process. So though we are discussing histology, we went all the way up to this so that our concepts are clear. We know that what exactly are we studying. Now over here, watch for that in kidney, can you see this structure, right? How this structure looks like. This structure is like, if I take a section here, so I'll see, because see, this is a 2D structure. Actually, it is the ball like this, and in between there are vessels. So when you take a cross section, this is the outer one, and all those capillaries, they are inside. See, so many, right? Here it is, right? Let's zoom it. Say here it is, we zoom it. Now this is the Bowman's capsule, right? This is the Bowman's capsule, right? And these are the capillaries which are inside. Still more deep, right? We go still deeper. Here it is. Now it is a full-fledged Bowman's capsule. What this Bowman's capsule was doing, we said that this Bowman's capsule, all those capillaries that they are coming over here. This is afferent, this is efferent. That water, right now I'm just taking the example of water. As such, so there are so many electrolytes, etc., that would be passing, and it will go into the tubular system. Agreed. It means this is the area where there is active transport. That's what we are watching, and that's what we are telling right from the beginning, that this layer, simple squamous epithelium, which is having a flat nucleus, it is the process, it will occur where there is active transport. So here is our active transport, right? Now you will appreciate the lining of Bowman's capsule. It is definitely a simple squamous epithelium. Not one, but so many examples over here. Here too, they are so nice, right? All those, all those are flat nucleus. I am erasing it now. See, right? Appreciate it. Correct. Can see, right? So that's what the it looks like. Still clear, still. Now the full focus is on absolute only one piece of Bowman's capsule. This one, right? Now I would like to draw your attention towards this part. See, you can say this is flat nucleus, right? There is one gentleman who is sitting over here, right? Is his nuclei also similar? Right? Let me erase it, and you yourself appreciate that. Is this our big guy and this one over here, do they look similar? And we are cheating. We are not watching the cells, we are just watching the nuclei, right? The nuclei which are over here, I mean this and this, do they look similar? No, no. Right? Just by looks only, it is looking different. See, this one, right? Here is someone over here, right? They are, what description you will give? That they are big, round. Can we say that they are big, round nucleus? Sure, you know. So what was there which was having big, round nucleus? Who was that guy? Right? Simple squamous. Simple squamous was having flat nucleus. So who was having that round, big nucleus? Yes, big round nucleus. That's right. So who was that? If simple squamous has got flat nucleus, so who was having? Exactly, very good, right? The cuboidal, because cuboidal said that this would be my dimension, right? Where the height is equal to width. So this is cuboidal. And do we see one layer or we see multiple layer? Well, there is only one layer, right? There is only one layer, right? One layer. This is one cell, second cell, third cell, fourth cell, fifth cell, right? That's how they are arranged. So just one layer. So easy. We call it simple cuboidal. So you have identified even that also. This means in kidney, it's so important that where you are taking the section. So if we take a section here, right? If we take a section here, so then this thing would look like this, because it is a collecting system. So it has got big round nuclei. So now you can confidently say that the Bowman's capsule, right? The inner lining of Bowman's capsule is simple squamous. However, the inner lining of this collecting system is simple cuboidal. How scientific, but as such so easy. You know? You identified it simply by its nuclei. Okay? So that's how it looks like. Now this is where that collecting system has taken its selfie, right? And flaunting with those big perfect nuclei, right? Giving a nice smile, right? So that's how they all look like, right? This is oil immersion, right? So you must be knowing how oil immersion, that this is a slide, and on that slide you just put a drop of oil, and then you have got that microscope in which there is 100x, and you take it slowly and just touch this oil. So the moment this oil is touched, right, this oil is touched by your lens, the oil would be acting itself as a say multiplication factor, and you will be able to see the images very crisply. So this is that image where you see these structures. So our next topic is simple cuboidal, right? So just a quick revision now. Simple layer of thin flat cells, disc shaped nuclei. Now we can just flaunt, right? It is a disc shape. We can give all sorts of shape, but in our back of the mind we know that it is a flat, right? That was the thing. But now we can say for the description that it is a disc shaped central nuclei, small amount of cytoplasm. Obviously the cytoplasm would be less because cell is flat, right? We can't see the cytoplasm, but we just say that it is a flat cell. That's why. And present arterioles we saw first. Arteries, yes. Inner lining of the heart, that was right. Atrium. Kidney glomeruli, yes, we saw that. And corpuscles. And lymphatics, yes, we saw that. And alveoli of the lungs, that's where this transfer occurs. So it means all these areas, wherever there is transport, that active transport, right, active transport is occurring, they come into picture, right? Okay. The next one is where simple cuboidal, right? Yes, I do remember that those points were to be discussed. We'll come to that. In simple cuboidal, now you will be able to finish this thing in minutes, because now the concepts are clear. You have to simply focus on what? One, large, round, central nuclei, again dark stained. See the so simple. Otherwise cells, they are single layer, and there will be moderate amount of cytoplasm because cell itself is bigger. If cell is bigger, so there would be more of the cytoplasm, right? Yeah, cedar wood oil. That's right. It is a cedar wood oil. Very good. So where do we see these? Kidney tubules and collecting ducts. That's the point. Collecting duct. That's what in fact we saw also, right? That selfie taken by that particular collecting tubule, in which it was telling that, see, these are my nuclei, right? Then ovary surface, ovarian follicle, parotid duct, right? That is the parotid duct. When you chew, when you eat, that's the parotid duct. There are three ducts, right? Parotid, sublingual, and submandibular. All these ducts into their secretory portion. So the point is that all salivary ducts, whether it is parotid, sublingual, submandibular, they will be displaying these type of cells. And go back just few minutes back when we said that they are for absorption and secretion. So in case of secretion, so in case of these glands, right, they will be secreting, correct? So here it is, same image, right? Fatafat, where is it? Where is that structure? Here it is, right? Here it is, right? That is the collecting system. This is the collecting system. This is the collecting system. That one is collecting system. See, because all are thrown into. See, there are so many tubules, because there are not 1, 2, 500, 400, 10,000. They are in lakhs. So that's why when you take a section, you'll be cutting so many of the collecting tubules, and that's why you are watching so many of them. However, those Bowman's capsule, they are big, so they are seen less frequently as compared to those collecting systems. Okay. Here it is, crystal clear. That let's move on to the ovary surface. In this ovary, right, as we zoom further and see, here it is so difficult to see those cells, but that plan that if we just see the nuclei, no doubt about it, right? These are large, big, dark nuclei, and all of them, they are so disciplined, right? They all are arranged in single layer. Nothing to think of further. It is simple cuboidal. Simple cuboidal. Done. Right? Still further. Wow. Now to see. Right? They are so good. Right? They are all simple cuboidal. So this is something which you just can't miss. And then at times you will wonder that, okay, they ask such questions in exam, right? They are so simple. What's the big deal in that? Well, they do ask. And any skill, once it is learnt, it becomes easy, right? That's why once we come in 12th standard, we give advice to our 6th standard students, right? In 6th standard, your course is so less, right? See our course. And same thing continues from class to class, right? So any hurdle, once crossed, it becomes easy. Right? So over here, these are the, say, nuclei. In fact, we do have some very big plans that these sections, these lectures, these are like for everyone. But at a later stage, a portal is in preparation, where right now, though, I have to tell you that, okay, gentlemen, please don't type, don't say this, don't type anything else, etc., etc. But over there, say, everyone can be analyzed individually. It means that if I throw a quiz, right, immediately everyone has to start answering on that. Let's say we complete the topic and we put a quiz, right? And in that quiz, if the 10 questions are asked, you will be given actually with that sort of timer that within this stipulated time you answer it. Once you answer, it would be evaluated. So I'll be able to see on my screens that who is doing how, right? Because our purpose is, there is no comparison between you and anyone else. If you are here today, tomorrow you should be here. You progress. You progress, right? Just focus on yourself. Don't compare with anyone else. Because when you go for comparison, that's where the trouble starts, right? So don't do that. It's fine that out of 10 questions, you answered only 5 questions correct today, but at least you attempted. है ना? Tomorrow you'll be able to answer 6, and if the consistency is there, very soon you'll be answering 10 out of 10 correct. But the day you'll start comparing it with someone, that thing would hurt. Seriously, that thing would hurt. And in that pain, you will stop progressing. So never be doing that. Say, even if you are not doing okay for some reason, right, no problems. Because everyone will be analyzed individually. So accordingly, the rest of the instructions would go. Okay. So here it is again. See, such a good, right? Such a good image. All those nuclei, you can't miss. You can't miss. So this is ovarian follicle. Ovarian follicle. Follicle means it will mature and then it would be released every month alternately from right and left ovary in case of when the female is into her reproductive age. Right? So every month one ovum would be released, secondary oocyte. It would be released for the fertilization. Right? So these are, now when we zoom that thing, this is considered as the largest cell of the body, right? And as we zoom this thing, as we zoom, see, so amazing, so amazing. Absolute discipline, right? Just one layer, and these are round, big nuclei, no doubt about it, right? So this is what is simple cuboidal, right? Simple cuboidal. Okay, here it is, right? Complete selfie. Parotid gland. Parotid glands, they are for secretion, right? When they are for secretion, so we need to see that in what point they really secrete. Where do they secrete? Let's zoom, right? Here it is. And see, this is what is called as the impeccable discipline. Big nuclei, big nuclei, big nuclei, big nuclei. See, just one layer. And imagine this is oil immersion, right? So actually this content is so small, but see how nicely all the way, right, they are arranged in just one layer, right? So good. And these are these are secretory. So this internal part, right, this inside, that is called as the apical, right? How apical? Apical means, say, this is a cell, right? This is a cell. So it is this tip which is called as apex. It is called as apex, right? That's the base. So basement membrane is here. So here what happens, let's say this is the basement membrane and these are the cells, right? So all of their apical areas, all these apical areas, they are pointing towards that duct. So everyone will be secreting like this, secreting into this space, right? That's how it occurs. So that is what is called as the apical. When we'll be discussing these glands in more detail, we'll see that there are some glands, that is also very interesting, that there are some glands which are very conjuice, right? They'll say we'll just secrete only from the apex. Some glands, some cells, right, they are like die-hard cells. They'll say we'll sacrifice ourselves and we'll throw ourselves into the duct, no problem. So they will be going for shahidi. So there are such different types of cells, right? Let's see further. Say this is so good, right? In fact, this is oil immersion, right? Such big round, no doubt you can't miss round big nucleus. Over here, sublingual, right? We can go quite pretty fast. Sublingual, right? You must have already started watching it. Yes, these are the, right, round big nucleus. Now see here, you might mistake is as, if you see the whole cell, that this cell isn't it columnar, right? It looks like columnar, but the moment you say no, I'll be focusing only on the nucleus. So nucleus is definitely round. It is not elongated, because I'll show you the elongated. Elongated is like this. So definitely this is simple cuboidal, right? Here is simple cuboidal, right? And so these were the kidneys, and where we saw this we have already seen, right? A very big, so single layer of cube shaped, large round central nuclei, moderate amount of cytoplasm, and ovarian follicles, parotid ducts, sublingual and submandibular ducts. No problems till this point, right? Okay. Now I'm going back to that image, that one, where we would see some of the extra piece of information, because it is so important, right? Tomorrow also we'll be doing this, so no need to worry. And tomorrow also we'll be continuing from where we are leaving today, right? We'll start exactly from that point onwards, so that nothing is left out. No doubt today was the preparation. Tomorrow things would be going pretty fast, because now I know that you will be able to identify the nuclei and everything crisply and instantly. Okay, some important things, so that this chapter is complete. We have seen simple squamous, simple cuboidal. We have not yet seen simple columnar, right? No worries. We just see some variation. What are these variation? That at times over here, whatever the areas which we saw, those cells, they were very disciplined, single layer nuclei. But over here, what if they go something like this? Some cell is bigger, someone is smaller, someone is teda meda, right? All these things, yeah, it occurs, it happens like this. So in such case, cells, they follow one simple rule, that as per the size of the cell, nucleus would be there. Now if the size of the cell is this much, right, nucleus would be like this. If the size of the cell is this much, so that nucleus would be like this, right? If there is another cell who is like this, so size of the nucleus would be like this. Now as we said that if we follow only the nucleus, it means we are just watching those nuclei, so we'll see that okay, these nuclei, they are arranged in different layers, right? Though, right, see, they are arranged in, we'll feel that they are arranged in different layers. Actually it is not like that, right? They are single cell arranged one after another, but because their height is different, that's why nuclei are seen at various levels. So this will give you a false judgment. It can give you a false judgment that it is stratified. Tomorrow you'll be watching the stratified. Tomorrow you'll be watching so many other images. But over here in histology, nothing is left by chance, right? That's where your concept should develop. It is not only the concept from your brain, but the concept of your eyes. Even your eyes should see it. And invariably now I can say that you can differentiate between this and this, right? Very crisply. But then keep in mind that in some cases it would look like this, where you will find that they appear like stratified. Reality, all cells attached to basement membrane, because their height is different, that's why they look like stratified. They are actually not. So whenever it's like that, so we use a word pseudo. False. It is not stratified, but it falsely looks like stratified, and that's why we give it a name pseudo-stratified epithelium. Got it? Right? Also the false stratified epithelium. As such, they are not. Okay. There is one more variation. Right? See, interesting. How interesting variations are there. This variation is still more interesting. This is where it tells that when I am relaxed, those cells, they will look like cuboidal. But when this organ would stretch, right, when this organ would stretch, their shape will be like squamous. You will say, what's this? Right? It is cuboidal or squamous? And yes, actually it would occur like this, right? Because when this surface is relaxed, it is like this, right? It is like this, big nuclei. And when same surface is stretched, so they will be stretched like this, and it looks like this. In reality, it happens, right? Where it happens? Bladder, urinary bladder. When urinary bladder is relaxed, it is like this. When it is stretched, it is like this. So what name to be given? We say we can't give any name. So because it is in between, whenever things are like that, we give the name that it is nothing but a transitional epithelium, right? So we learned two things. Transitional epithelium, so word transitional, and second word which we learned is pseudo. Got it? Right. So this is seen in urinary bladder, ureter. Watch this word, urothelium. Many of such words would come up, right? As you will go more and more into the medical science, many of such words would come. Urothelium, nothing more, it is urinary system epithelium. Correct? So that's why we say urothelium. Urothelium, right? Easy. All right. There would be one more variation, and this variation is still more interesting. And that variation would be like that till this point we saw all these cells seedha sada, right? It means this is the cell, but that's it, and the nucleus. What if there are some projections? There are some projections. Something is pointing out from them, right? As if it's like a grass. Something is emerging from it. Now, its size can be different. It can be they are called as villi, right? So when that's the surface, and those small ones, right? They have got tremendous importance. Actually, The cell is so small. On top of it, these are small villi. In these villi, there are muscles. Yeah. And then all of them, they move in synchronicity. They move in synchronicity, right? And that's how they keep on shifting whatever the fluid which is getting collected over here, right? So these villi, they keep on shifting the fluid. How interesting, right? They keep on shifting these fluid. When this fluid is getting shifted, in case if these villi don't work, then that fluid will remain there. Once it would remain there, it can lead to so many diseases, right? Let's see. Microvilli, right? They are like brush border. They are not motile. They are just standing, right? They increase surface area in gallbladder. What gallbladder is doing? Gallbladder is making bile, right? So that's your liver. Sorry, right? Let's draw it better. That's your liver. Liver would be producing the bile, which will be collected into the gallbladder. The function of gallbladder is 50 times concentration of that bile, so that bile can be stored. So whenever you eat that butter sandwich, right, or whenever you eat any of the fatty substance, the gallbladder would say, okay, I am sending the bile, this would be released, and into the second part of duodenum it will open, and whatever the stomach, whatever you have put into the stomach, when that food comes over here, bile is ready to bombard it, and it breaks that fat into small globulins so that it can be digested, right? This bile, this gallbladder is so small, so they said that we need to make it concentrated. So what should we do? Say there is one very nice method. You increase the villi, right? So if this is the surface, but what if we make this surface like this, right? If we make it like this, are we increasing the surface area? That's the point. We increase surface area. By increasing the surface area, we are giving more chance for the process, right? So it is like a brush border. It increases surface area, and you see it in the gallbladder, right, over here. When it comes to stereovilli, or they are also called as stereocilia, because they are in between both, not motile, they are longer into epididymis, organ of Corti, that is inner ear, etc. Right? This is, don't worry much about it. We'll discuss as we'll come to that. But this part, this is cilia. This is what we are interested in. If you just remember that this was the microvilli which was standing over there, not moving, its function was to increase the surface area. And we have cilia which are motile, right? They will be moving like this, and they are hair-like projection. So in case of uterus, in case of uterine tubes, middle ear, eustachian tube, ventricles, all these areas, because in uterus, right, in uterus, say that's the uterus, these are the fallopian tubes, right, that's the fimbrial end, and here is the ovary, and as that ovum it moves, right, this ovum moves because of the muscular activity, which is called as the peristalsis. So it keeps on moving all the way. But this ovum is supplied with lymph, nutrition, so that it survives, and then it reaches all the way into the uterus and gets embedded over here for the further development, right? So all these cilia, see, they are into uterus and uterine cavity. Uterine cavity, this is called as the uterine tube, or the fallopian tube. So in that there are villas. So those villas, they will keep on moving, and they will keep moving this ovum along with the fluid nutrition, and it reaches till the end. Now when we go into the depth, right, see these microvilli. When we see, say these are all proteins, actin, myosin, right? These are all proteins, binding actin proteins. That's how they all are arranged, right? At this point, not to be worried about what is this M2, etc. But these are various proteins. That's what you have to understand. These are the various proteins. It means that villi is not just a normal thing. There is so much of microscopic, super microscopic contents even inside it in the form of proteins. And then these proteins, as we go into depth, right, they are made up of some compounds, right? Those compounds where the multiple types of all those electrons will be there. Yeah, this is cilia. Now this is so interesting. We are talking about this, something which is moving, right? Over here in case of say microvilli, so it was like just sitting, standing over there. It has got strength. Cilia has got such structure. See, so much. It means it has got central sheath, tubules, spike proteins, dynein proteins, etc., etc. Such things, such a complex whole network. That's the reason, because see, all of them, they are arranged like this. So if this is anchored, right, and then only this side contracts, so then that cilia would move like this. If this side contracts, so that's how in synchronicity they will keep on moving. And over here, dynein, this is the word, dynein protein, right? Dynein protein. This is needed, which is making this entire movement possible. For some reason, if there is no dynein, this means this was the structure, this is the protein which is responsible for that movement. That's the protein. For some reason, if this protein is not there, so then, ladies and gentlemen, we are talking about immotile cilia syndrome. Syndrome means it is group of so many conditions, right? It is not a standalone thing. There would be so many things associated, but it is immotile cilia. As we said that cilia, so they move like this, but now they are not moving. They are not moving. That means what? What was their function? Their function was this, it was taking the secretions further. Now that secretion will not be removed. It means that secretion will remain there only. It is present into respiratory system, right? So every time our sinuses, right, they keep on releasing, keep on clearing the mucosa. Now keep on clearing the mucus. Now that thing will remain over there. Something which is stagnant, something which stops, flowing water, it never gets spoiled. The water, the moment it stops, it starts getting spoiled. Same thing is over here. That mucus which is not removed starts the infection, right? Wherever you find the word itis, this means there is infection. So there is chronic sinusitis, bronchiectasis, respiratory condition. And see, situs inversus. What's that? Situs inversus is, this is so interesting. Situs inversus is, normally the heart is on the left side. In this case, heart is on the right side, right? Every organ is on the opposite side. Situs inversus. Why it happens? Because when the baby is getting developed, right, so then there is a rotation. The entire baby rotates. So all the organs, they go back into their original position, right, the way they take birth. So it means heart also moves on the left side, right? Then liver is over here, right? The liver also from left side, it moves to right side. Everything changes because the entire world is rotating, right? It is rotating. This rotation is with the help of these cilia. Now for some reason, if this dynein is not there, so then imagine what would happen into that baby. That rotational process will stop. It won't occur. That means everything would remain in its opposite direction. That means the heart, which was supposed to be on the left side, now it is on the right side. Heart is developing, right? Because development of the heart has got different functions. So heart is developing normally. Stomach, intestine, all liver, everything developing, but that rotation has stopped because that rotation was carried by those cilia. Cilia are not working because dynein is not there, so they will remain over there. This is what is called as the situs inversus. Entire site is inverted, right? Like a normal. And because of all these movements, such patient will be having severe coughing because their mucus, right, it is not moving. At the same time, these cilia, they play very important role into the movement of the sperms and the ovum. In case of male, sperms. In case of female, ovum. They would be sterile because, say, that movement is not possible. Now that movement is not occurring, and when it is combination of all these, that is chronic sinusitis, there is bronchiectasis, there is situs inversus, right? Why this? Why I am teaching you this? You are sitting in a clinic and you come up, a patient comes, a young patient comes, and he tells that I'm having continuous sinusitis. You just take the x-ray and you find that everything is stuffed, all right, and you just try to auscultate and you will find, where is heart? And you find that heart is on the right side. There has to be batti in your dimag that, man, you are dealing with Cartaginer syndrome. Why? Because this patient is a young patient. He has not yet got married, right? But you have picked up this important thing, that situs inversus, and he has got severe chronic infection of lungs. This is definitely a patient who will be sterile. You, just by simple diagnosis, you have saved life of 2%. Because this person, when he or she will be getting married, there would be trouble because they won't be able to conceive. And as a good doctor, when you have learned this much, so just by one basic thing, you were learning like cilia. But when you find these things, and so this, and see, they are so easy to diagnose, right? Sinusitis, so easy to diagnose. Situs inversus, you put the stethoscope and you know it. Even when you have taken the X-ray chest, right, you find that all the structures on the opposite side and lungs are studied. Immediately, it should come in your mind that you are dealing with this Cartaginer syndrome, right? So that's how it works. So that's the reason why I wanted to talk about this. This is, now there is a technical term for it. This is what is called as the primary ciliary dyskinesia, right? Don't worry about it. That's okay, right? These words, so they will keep on coming. But at least if you have understood the core concept, that is the happiest thing for me, right? So tomorrow we'll be starting from this point onwards, and tomorrow we'll be covering lots of ground with so many images about other structures, right? Till then, thank you so much. Take care and see you tomorrow. Thank you so much. And bye-bye. Bye.